Whenever you read a news about a young adult, especially an athletic adult, having a sudden cardiac death while playing a sports, let's say something like football, think of one condition, and that is HCM, Hypertrophic Cardiomyopathy. Now, what is HCM? HCM is typically a cardiomyopathy which is autosomally dominant in nature. This is a mutation that happens in sarcomere proteins and that leads to a heart which has asymmetric hypertrophy of the interventricular septum. Along with that, there is also abnormal movement of the mitral wall leaflet. Together, these patients do not typically have the features of heart failure, something that we expect in a lot of cardiomyopathies. They don't always present with heart failure. They can have signs, for example, they can have systolic murmurs, they can have a double impact of the cardiac apical impulse, but all of these are signs without symptoms. The symptom typically presents with sudden cardiac death. When we use the word sudden cardiac death, we are talking about a death which is within typically an hour of the onset of symptoms. But why would someone who does not have features of heart failure lead to sudden cardiac death? Well, the answer is ventricular arrhythmias. These patients are predisposed to ventricular arrhythmias which come unannounced, and a ventricular fibrillation can lead to immediate death. Screening of family members is important and genetic testing is going to be important. If the patient has these features, implantation of an ICD, that is implantable cardiac defibrillator, and use of drugs like beta blockers is going to be helpful. But most important of all, awareness about HCM needs to be increased. I hope this information helps you to go back and read more about HCM.